Medicine is a constantly evolving science. We cannot be satisfied with our current knowledge and technology. We should be actively exploring new treatment methods. Open up new surgical methods to meet the needs of medical development and patient complaints.
Bed 32, 2300932.
Exactly.
It's the one on the right, right?
The right. The lesion is in the right inferior frontal gyrus, left supine position.
Okay.
I'm a brain surgeon. I have been practicing neurosurgery for 17 years. My area of expertise is craniotomy, mainly covering cerebrovascular diseases and brain tumor diseases, especially skull-based tumors. In recent years, my mentor and I have developed a new surgical technique, ultra-minimally invasive craniotomy, also known as burr hole technology.
Make a hole here in the skull, take it out, and after that, I'll go a bit deeper and remove it. It is classified as a tumor in the frontal lobe. So today, we might have some interference with M3 and M4.
Yes, sir.
Give me drill.
The burr hole technique is a minimally invasive transcranial approach. This technique involves making a hole the size of a fingernail in the person's skull. So what about from this little hole? We excise the intracranial lesion through the small hole. Compared to traditional craniotomy, it is less traumatic, has fewer postoperative complications. Patients recover faster.
Send all the specimens you've received for rapid pathology. Go ahead.
Professor Zhao Jizong once said a sentence in a public setting, which inspired me a lot. In a craniotomy, whatever you take from the patient, you must return in equal measure. If you take less, it's not just minimally invasive surgery for the patient. To lead surgeon, it also reduces some operations. So these two good things can be achieved at the same time. Why don't you improve your minimally invasive technology?
Nothing else. It went well. Now closing the skull and suturing. Should be out in about an hour. You can wait at the door.
Thank you, doctor.
No problem. Did you used to have a bit of a tremor in your hands? Did you?
Yes.
Mainly happens when you're walking. We still need to assess the tremor in your hands while walking. Good job. If the tumor is an infiltrative one and you manage to clear it effectively using the Dolank approach, there's a possibility that not only will the symptoms not worsen, but they may even improve, or in some cases, lead to a full recovery.
At first, I didn't feel much about studying medicine. This is just the parents' hope.
Do you have trouble sleeping at night?
No, I don't.
You don't? That's good. That's good. These symptoms might improve in another 2 months. Yes, it takes time. These symptoms are all a result of your brain hemorrhage, right? You didn't have these symptoms before this, do you?
However, when seeing patients heal again and again,
Hold my hand. You have a lot of strength.
Thank you, thank you.
this sense of accomplishment made me fall in love with this job.
Take a rest.
Thank you. Thank you.
You're
Thank
welcome.
you. Avi, you brought your flatbreads again.
I really appreciate it. Thanks a lot for bringing these. Capture the part about the flatbread.
And this sense of accomplishment keeps pushing me to refine my skills and develop new treatment modalities.
The width of this rectangle is the same as my glove. This length depends on the depth of the lesion.
Hey, son.
Yeah.
Yeah.
That's very
So some of our employees work for Nico, and they sell something like this for $20,000.
The purpose of taking picture is to show others Chinese doctors do it for free.
This virtuous cycle makes me feel fulfilled and happy. The Dongli Eye Brain Hospital in Shanghai, China, where I practice, is a medical tourism pilot institution and has direct payment agreements with several well-known global insurance companies. My hospital is committed to providing outstanding service, extremely affordable care, and exceptionally high efficiency. If you are seeking high-quality surgical care, please feel free to reach out to me via email. My English-speaking assistant will be happy to respond to your inquiries. Additionally, I created this channel to connect with colleagues around the world and exchange ideas on advanced surgical techniques.